Welcome again to the Practice of Possible podcast with your host, Coach JPMD. And today I wanted to do something a little different, like I said at the beginning, and that's share some of my story because, my mission is to help populations live long. And to do that, I think we really, as physicians, need to care for ourselves the most. Sometimes we neglect our health. And today's episode is personal. It's about my health. It's about my journey to crazy blood pressure. I have my blood pressure machine here, or my sphygmomanometer, as we would say. And I don't think my reading is here, but anyway, I can tell you that in the end of January, I was checking my blood pressure because I actually woke up with a nosebleed. And I hadn't had a nosebleed in a long time. And I said, let me check my blood pressure. Now, at that time, I think my systolic blood pressure was 159 and my diastolic blood pressure was 107. And that kind of freaked me out to the point where I'm like, whoa, what is going on? I had not seen a physician in a very long time. And I felt it was time to do something. So, disclaimer, nothing that's said here should be taken as medical advice. Please seek advice, the advice of your physician, your practitioner, provider, because that's really the best way to get care. It's not through podcasts and not through me telling you my story. So definitely make sure you seek your own medical advice, especially for things like hypertension, which can be a silent killer. And as a 52-year-old, soon to be 53-year-old physician, I think it's important to first examine myself. You listen to, I listen to Huberman, I listen to Joe Rogan. I even listened to my son, who actually took me to a sauna recently, and I did my first cold plunge this past weekend. So I think, if you look at pro athletes, if you look at people who are really performing at a high level in this world, we have to look at what they're doing. And it reminds me of a book I read called The 7 Habits of Highly Effective People by Stephen Covey, where he talks about being proactive as one of the first habits, and being proactive with yourself, being proactive with what you need to do for your own self in order to be effective and effective for other people. So I knew something was wrong, and I said, let me attack this maybe a different way. Believe it or not, I was adamant about not starting medications, even though I prescribe medications all the time, and been doing that for 25 years. But I said, let me do something different, because I've done some research on saunas. I've done some research on cold exposure, heat exposure, and I found some articles that and I'll share some of those articles at the end of the podcast. But some of those articles, actually, let me share one with you right here. This is the first time I'm actually doing this live, so bear with me. So if you look at here, and sauna bathing is associated with reduced cardiovascular mortality and improves risk prediction in men and women, a prospective cohort study. So this study looked at the cardiovascular events, fatal cardiovascular events, and compared people who actually did saunas on a regular basis and those that didn't. And they found that there was up to a 40 or 50% reduction in cardiovascular mortality in patients who actually did sauna. I also read some other articles and research papers on how hypertension or blood pressure was affected by sauna, with a mean decrease in some studies of about 8 millimeters of mercury. So what did I do? I went and embarked on a 30-day sauna challenge. And I have a gym membership. I won't say the gym, but it's a local gym that has a sauna. And let me stop sharing this, because you probably don't want to see this anymore. And I said, let me do something different. I started taking some supplements. I had some deficiencies after doing some testing with a functional medicine doctor that was actually on my podcast, Stacey Robinson. I can't remember the episode number, but I'll share her episode as well at the end of in the show notes. But she was able to identify some things, some nutritional deficiencies through some specialized blood work that I did. And I started taking some supplements about 2 months ago and did a 30-day challenge. So I think I did 32 days, and I actually was in the sauna today. And lo and behold, from a blood pressure of 159 over 107, I recently had a reading of 125 over 82. And that is just with heat exposure. Is it related to supplements? Is it related to exercise? I was exercising before, and I was taking supplements before, maybe not as intensely as I have been over the past couple of days and weeks. But what does that tell you? What does that tell me, I should say? That tells me that, number one, you can lower your blood pressure with supplements and heat exposure, which is what I did. Not to say that this is safe for everyone, but when you look at populations like the Finns, in Finland, my research has led me to understand that pretty much every household has a sauna in Finland. And if you look at the life expectancy of I believe it's Finnish citizen. Is that how you say that? Hold up. Let me share that with you here, because I think it's important to look at data. And you see here, I think I'm sharing this. So if you look at the number one country that with the highest life expectancy or the longest life expectancy is Hong Kong, with the life expectancy of both sexes of 85, females living longer, and that typically happens if 88 years versus 83 years. So if you scroll down, Finland, which has a much smaller population than the U.S., and I'm sure that plays a role. Their life expectancy, median life expectancy for men and women, is 82.52. Now, is it because they have a sauna in every household in Finland? I'm not sure, but it's worth looking into, because when you compare it to the U.S., and I kind of did this study here. See, the median life expectancy of a U.S. citizen is 79. So, obviously, there's much more than just sauna that might be contributing to this. But I invite our listeners to kind of reflect on what are we doing in this country versus other countries, and how can we do things differently to serve not only ourselves but also our patients that we take care of on a daily basis. And we offer medications, we offer things that other countries might not be doing as much as we are in this country. So that is my story today. That's my episode. It's an episode on my personal health. There's more to that to come. I'm working on other things and other episodes that it's going to bring some more clarity to what you as a physician and as a healthcare provider can learn about and can potentially implement in your practice, because sometimes it's not all about medications. And I actually haven't had a chance to put my blood pressures in a spreadsheet, but I'm going to do that. I just haven't had the time to do that yet. But it is in the machine. I actually got a new machine that actually syncs up with my phone. So every time I take my blood pressure now, I actually can sync it to the phone so I can keep a running tab. And so that's my blood pressure story and my sauna story. So if you want to learn more, take a look at the show notes. If you like this episode, please share it with your friends. Hit a like, leave a review. Love to hear what you think. Thanks for listening. Thanks for watching.